You might be extremely surprised. The thing that has the most control over your knee pain, the thing that can truly help you, is literally. I can't believe how many people don't know that knee surgery isn't always necessary to relieve chronic pain, let alone acute pain. Whether it's for old knees or younger ones with supposedly torn meniscus or ligaments, there are solutions that will surprise you. Give me a few seconds to get to the clinic and we'll break it all down together. 1.5 billion people worldwide live with chronic pain. So if you enjoy my content, subscribe. It takes just 1 second. But most importantly, leave me a comment to let me know you've subscribed and share this video on social media. You can even create short videos from it. Help spread the message to reach and support as many people as possible. Finally, every month I offer a free consultation to one person via video call or directly at my clinic. Let me help you better understand your neuro-musculoskeletal pain and provide you with personalized tools to manage it at home. To participate, subscribe to my YouTube channel and leave a comment under the video mentioning that you subscribed and describing the issue you'd like to discuss. To double your chances, visit cliniquepsb.com, go to the health articles section, sign up for my clinic's health newsletter, and choose an article to leave a comment with your YouTube username. Good luck to all. In Canada, the number of knee replacement surgeries has increased significantly in recent years. In 2014-2015, approximately 61,421 knee replacement surgeries were performed, marking a 20% increase compared to 5 years earlier. These procedures primarily address cases related to degenerative arthritis, which accounts for nearly 98% of the diagnoses associated with these surgeries. In the United States, the volume is even higher, with millions of knee replacements performed annually. In Canada, the average cost of a knee replacement surgery exceeds $9,100 per procedure, excluding physician fees and rehabilitation costs. Annually, these surgeries account for over $1 billion in expenses for the public healthcare system, a substantial financial burden further exacerbated by the increasing number of procedures performed each year. This raises a critical question. How many of these surgeries are truly necessary? Research shows that in many cases, the results from these surgical interventions are comparable to those achieved by conservative alternatives such as movement rehabilitation or even a placebo. This data suggests a trend of recommending surgeries too quickly, sometimes without thoroughly exploring non-invasive solutions. But before delving into these implications, did you know that tissue tears, such as those in the meniscus or ligaments, and degenerative processes can be completely asymptomatic? These findings, often discovered incidentally through imaging, sometimes lead to biased clinical decisions, resulting in inappropriate treatments that increase risks for patients and costs for the healthcare system. This highlights the urgent need to revisit protocols and rely more heavily on scientific evidence. Several studies have revealed a dangerous overuse of unnecessary surgeries. Let's examine these trends and their implications in more detail. Several studies have compared knee surgeries with placebo treatments or physical therapy, and the findings have raised significant questions about the necessity of surgical interventions, particularly for degenerative conditions like meniscal tear or osteoarthrosis. One landmark study from 2002 demonstrated that knee surgery, such as arthroscopy for osteoarthritis, showed no superior results compared to a placebo procedure where patients underwent sham surgery with skin incisions but no actual intervention. This has been confirmed in multiple follow-up studies, including a 2016 review, which found that surgeries like debridement or lavage provide no better outcomes than a placebo. Also, a notable study compared arthroscopic partial meniscectomy with exercise-based therapy for patients with degenerative meniscal tear. After 5 years, conservative therapy was found to be equally effective as surgery for improving knee function, challenging the widespread use of surgery for such conditions. Despite this, meniscal surgeries continue to be overused. These findings raise doubts about the common practice of recommending knee surgeries too quickly without fully considering less invasive options such as conservative care therapy, which may be just as effective for many patients. This is especially relevant when considering the prevalence of overdiagnosis in knee conditions. Overdiagnosis, simply put, refers to the identification of conditions that are either not clinically relevant or discovered incidentally during investigations for unrelated issues, and which cause no symptoms or problems for the patient. Several studies have assessed the prevalence of degenerative knee conditions like cartilage defects, meniscal tears, and osteoarthritis in asymptomatic individuals. A meta-analysis of MRI studies found that 24% of participants had cartilage defects, with 10% showing meniscal damage. These conditions were more common with age. Cartilage defects were 11% in those under 40 and 43% in those 40 or older, while meniscal tears were 4% in younger adults and 19% in older adults. Osteophytes and bone marrow lesions also increased with age. I understand that all of this might be confusing for many people watching the video. So let's wrap things up clearly and simply. First, it's easy for the healthcare system to make false diagnoses that don't align with the patient's actual symptoms. Many patients, and even medical doctors, struggle to understand that joint sensitivity can stem from overload due to physical and psychological stressors, not necessarily from a degenerative process or an asymptomatic tissue injury. This misdiagnosis often leads to unnecessary surgeries that, at worst, present more risks than benefits, and at best are as effective as a placebo or simply equivalent to physical therapy with a home exercise program. Therefore, what has the most significant impact on knee pain and long-term improvement is not surgery, MRI scans, cortisone injections, or conservative therapy, but the patients themselves trapped by their pain. Chronic pain often drives patients to seek explanations for their joint sensitivity. Some may get lucky with a misdiagnosis and undergo treatments to improve movement, but others stay within the healthcare system unaware of the true source of their problem. This limits their autonomy and prevents them from doing at-home muscle strengthening, which could, over time, reduce tissue sensitivity and help them return to physical activity. Yes, we can treat patients in the clinic with musculoskeletal rehabilitation, and yes, we can guide them. However, it's crucial to realize that even with the best rehabilitation treatment, you only spend 30 minutes to 1 hour in the clinic 1 or 2 times per week. The rest of the week, you have the opportunity to follow your own strengthening program and exercise outdoors, respecting your movement limits and tolerance. Give yourself the chance to let pain guide your recovery and take control of your health. But most importantly, remember this important step. It is imperative to take 1 second to subscribe and hit the bell to be notified of all my new videos. I'm wrapping up for today and heading home. In the meantime, feel free to share your stories, comments, suggestions, or ask any questions you may have. Because with knowledge, you build your autonomy, navigating your health with more certainty.